All right. We're back again, loners. Hope y'all are doing well.
It's raining outside.
It is.
We thought we were done with the rain.
Yeah.
Here it is again.
Apparently this is how it is in the UK. Pretty much like all year round. Cold and rainy.
It's cool for a bit and then it gets old and then it's just like an inconvenience. It's like, all right, we get it.
Yeah.
You made your appearance. Now get out.
Yeah, apparently, because it was hailing the other day. I got caught in a little bit of hail in the car, and I was like I wasn't freaking out, but I was just like, whoa, this is crazy, because it was like you could.
It's funny that
sounded heavy.
Oh yeah, it sounds like marbles are hitting your car. Yeah. It's just funny because people who deal with snow all the time are probably just like, you guys are bitches.
Yeah, you're not
That's
wrong.
why we live here.
You're not wrong. Yeah.
Ow.
That's so true. You okay?
But yeah, I know the cord was under my foot. All right, what's today?
So,
it's episode 54, you said?
Roll that intro. Today we were thinking about doing, we did already one with how the German healthcare system compares, but it seems like there's a good amount of them, and it's cool to compare the different countries. So we were thinking we would do how French healthcare compares to the U.S. system.
Cool.
All right.
Are you interested? By NBC?
CNBC. I'll put the original down below.
The table closer?
Yeah. Anything else you want to say, Linda?
That's it.
All right, let's begin.
Healthcare is becoming a big issue in the 2020 elections. The Democrats are pushing for a government-funded model, while President Trump is campaigning on gutting Obamacare.
We repealed the core of the disastrous Obamacare. The individual mandate is now gone.
Medicare for All has become a mantra among left-of-center Democrats in the presidential race.
Healthcare is a human right, not a privilege.
I strongly believe that we need to have Medicare for all.
I am a strong supporter of Medicare for all.
The candidates do have different interpretations of what Medicare for All actually looks like in America. Those differences aside, it's essentially a universal single-payer system, closely modeled after Canada's healthcare system. But there's another national healthcare system that gets a lot of attention. France. Back in 2000, the World Health Organization ranked it as the best national healthcare system in the world.
Wow. Out of 191 countries. Interesting. Y'all must be doing something right.
Clearly. Can we find out?
You know what?
A lot has happened since then, but France's healthcare system remains a model for universal coverage. Here's why. Despite spending less on coverage, France has comparable or even better healthcare outcomes than the United States. The United States has a higher rate of infant mortality. In France, nearly 4 children die out of every 1,000 live births. In the US, that number is closer to 6. France also has a higher average life expectancy than the United States by 4 years. And the rate of rehospitalization in France is 5.3% lower than that of the United States. Lower rates of rehospitalization in France are likely due to better access to primary care, as well as longer average stays in the hospital. Since France gives every citizen coverage from birth.
So, yeah, that makes sense where...
I want to know how long it takes them to get seen, though, when they book an appointment.
Oh, yeah, like how long the wait time is?
Yeah, like the waiting period to go get a physical or, I just want to know how long.
If you, any Frenchies out there watching, let us know. Because,
how long? I want to know.
They probably just make it a point to actually cure people rather than...
It seems like they're preventative.
It seems like most other countries,
yeah. Whereas us, they will kind of...
It's
just our experience that unless, you're paying top dollar for certain insurances, they kind of will just find an excuse to not get the right test you need unless it's like an emergency, like that they can see.
So they make you keep coming, like they want you to keep coming back.
Yeah, from our experience.
Yeah.
The system allows them to get more preventative treatments throughout their lifetimes, which save on costs and improve outcomes.
That makes sense.
After World War II, French politicians were concerned the country's private healthcare system would not be able to handle coverage demands. So the country established a model of national health insurance, meant to protect the population against increasing healthcare costs. The French call their system Social Security, but it is not an example of socialized medicine. It's not government-run, just government-financed. It's very close to being a single-payer healthcare system.
I'm Pierre-Yves Joffard. I'm a professor of economics at the Paris School of Economics. Every individual who lives in France, whether he or she is a foreigner or a French citizen, is covered by basic social security. Everyone has access to care. Doesn't mean free access to care.
Is that if you live there?
They said even a foreigner.
Well, you could still be foreign and not be from there. I mean, and not live. My point is, you could
like
live there.
you mean?
Yeah, like if you're a tourist versus like a resident who just isn't from there.
I would go.
I wonder if, like, knock on wood, you need to go to a hospital if you're covered. I don't think that is. Which, honestly, to be fair, I don't blame them. They shouldn't have to cover tourists.
No, I understand, but I'm sure to a certain extent. What about when people go do, like, I forget who, some professional sports player went and did some surgery, and it was like an insane surgery, costs a lot, but he went to Germany to do it, and it was like less than half the price.
Well, yeah, my point is it's not covered. It's cheaper.
It's like way cheaper.
Yeah, that's why people go to like Turkey to get like, what are they called? The hair implants.
Oh, wow, yeah.
Or people will go there to do dental work, or Mexico to do dental work.
Mexico, they go a lot,
I remember a long time ago when we were kids, I remember hearing people would go get implants and stuff in other countries because it was way cheaper.
But let us know in the in the comments wherever you're from. Are tourists like covered to an extent when they're just there visiting if they get hurt? Yeah.
Right.
Bad access to care with reasonable copays.
This mandatory coverage doesn't come at the expense of freedom of choice in medical care. The system is set up to ensure that doctors are not restricted when making medical decisions.
The system covers every doctor, every lab, every hospital, every clinic. They're all covered, and they all have to take the patients.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
America's the only place where we have what the insurance companies call narrow networks, where they dictate which doctors you can go to. No other country does that. In every other country, the patient picks the doctor and the system pays.
That's what we do here.
Yeah, that's what he was saying. We're the only country that does that.
It's crazy.
Yeah, that they make it so complicated to find a good doctor.
They will, they'll tell you, like, based off your insurance, you can only see these people. So they try to, they pretty much try to dictate that if you have shittier insurance, you're going to be with somebody who's not as qualified.
Yep.
Instead of, it's like, that really shouldn't matter. Everyone should have the same access
to the same good doctors.
Yeah.
That's also true for our Medicare system. Medicare covers all doctors. So here's what happens in the United States. Let's say somebody, a clerk in 7-Eleven or hotel maid has no insurance or very little insurance, and she feels a vague pain on the right side of her abdomen. It would cost her $120 to go to the doctor. She's not going to do that. She's going to work through it. And 3 months later, she's in the emergency room with a burst appendix. It costs $60,000. And we'll treat her. But if she could have gone to the doctor when she felt that first pain, the doc could have treated the infection. It would have cost $100 instead of $30,000. The way we do it, by definition, makes things much more expensive because covering everybody so that people get the care they need when it's still early and cheap is a much smarter and a much less expensive way to provide health care.
France's Social Security reimburses around 70 to 80% of medical costs, leaving the remaining amount for patients to pay out of pocket. Wow. France also has voluntary supplemental health insurance provided by private insurance companies.
But in France, they want you to know that you're getting something of value from the healthcare system.
That's smart to do both. So you have, I think other countries too that we've seen do that, but that's nice, 70 to 80% from the... without paying like a monthly anything. Yeah, that's really nice. And then if you choose
also, it probably doesn't even cost nearly as much as here. So 70 to 80% probably feels like a huge weight lifted off.
I think I wasn't going to say the government pays for, but the taxes that people put in pay for all the costs. Yeah.
Okay. Oh, I thought
No, I
thought
was
you
just
had
saying.
something.
But in France, they want you to know that you're getting something of value from the healthcare system. So they make you pay, and then everybody in France gets about 80% of it back from the insurance company.
France's Social Security also legally requires
That's
price
awesome.
transparency. And because the government-funded system covers the entire population, it has more bargaining power to keep the prices low. Social Security also has no waiting list for specialized hospital
Wow.
treatments. There's also no physician gatekeeping. French patients do not need their general practitioner to sign off so they can see a
What?
specialist.
That's amazing.
That's wild. First off, the no waiting is wild because here you're waiting, period.
This just would, if I was a citizen there or anything, I would just feel like equal to my peers. You know, like a lot of times here, you don't feel equal because whatever you're able to pay, like we said earlier, is what you get. So if you're
Everything is classes.
that's
here.
what I'm saying.
That's
It
what they're
separates
saying.
like that. So like obviously you're not gonna have someone who is on Medicare sitting in the same room as someone who's paying $2,000 a month for the top notch
For, like,
healthcare.
yeah,
Exactly.
Yeah, for sure.
Yeah.
So how does France's system stack up against
I just
America's?
thought that was cool.
The French
They don't
healthcare
have a
system
waiting
is
period
considered
at
one
all.
of the most expensive in the world, and yet it's still half the cost of
Yeah.
America's. In 2017, U.S. spending added up to $10,200 per capita. In France, it was only $4,900. Administrative costs are also much lower in France than in the United States.
In France, they're limited to 5.5% of the bill. Whatever the bill is, the administrative fee can't be more than 5.5%. In America, our private insurance companies have administrative costs of 20% on every bill. And that's so important to our insurance industry that their lobbyists wrote that into Obamacare, that they're allowed to add 20% administrative costs.
For
One of the
private?
ways the French keep their administrative costs lower is with the carte vitale, a health insurance card carried by every French citizen. When a person visits a doctor in France, they present their carte vitale so the doctor can look them up in the digital system. The card gives the doctor all the information they need to charge for the visit. French citizens can also opt to have all their medical records stored on a card for doctors to access.
So smart.
And because the system is available all over the country, it saves time and money. Another way France manages rising healthcare costs is by having the government regulate them. Unlike the United States, where legislatures are deadlocked on what to do about healthcare, the French parliament votes to set new healthcare budgets and guidelines every year.
It just feels like here it's not a priority. It's kind of like, okay.
Well, it's a priority to keep it the way it is because the lobbying in the medical industry, they're able to just take as much money as they want and not think about like, hey, we need to actually make sure that we aren't gouging these people
Everything
for their
is a
money.
business here. Nothing is like for what it's intended to be for here. That's just what it feels like. Everything you can get bought out.
Yeah.
And it's like fuck the greater good.
Well, we've said before, but like certain industries just should not be meant for profit. Like in France, like this looks like you just don't feel like when you go to the doctor, you don't feel like, shit, am I going to be able to pay for this? Are they just taking my money? Are they going to lie to me? Like,
Yeah.
it's crazy.
Yeah. And the worst part is everyone's under this illusion here and, purposely under this illusion that it's like, we have it so good. Look, we have the top of doctors in the world. We have this, we have that.
Yeah,
It's like,
we do it the
what
best.
access do we actually have to like the best here?
To me,
the majority of people
yeah.
just don't have access to it.
Yeah.
But because some people do,
Yeah.
they think everyone here is just like balling out.
Yep.
Everyone's living their life.
best life,
Lives
yeah.
next door to Tom Cruise. Like, you know what I'm saying?
Yeah.
Everyone thinks like, but really the majority of people here are just scraping by.
It's a delusion, I think, that
not-
is seen.
Yeah, and then it almost makes people feel like there's something they're doing wrong.
Yeah, I guess you would say like an illusion, right? Because it's like a fake thing.
Yeah, I was gonna say that, but then I was
sorry.
like, I think that's what you meant to say.
But I was gonna say, to me, this feels more like freedom, like what they're talking about with this medical industry, how the citizens feel like equal and feel like they're taken care of. That to me is freedom.
I mean, I don't know every detail, but it doesn't seem like there's a hierarchy, or at least they don't feel like there's a huge hierarchy.
And it seems like the government doesn't allow that. And every year they keep going in there
maybe
to
not.
vote on stuff to make sure that everything is like affordable and stuff like
Max.
that. Our dog is snoring so loud. All right.
Parliament votes every year on called an objective, but it's kind of binding. The objective, the Objectif National de Dépenses d'Assurance Maladie, so the national objective for Social Security expenditures, and everything, and all expenditures have to stay in that budget. Of course, they don't always do, but still it's a very effective way to control costs.
But France's healthcare system is not perfect. French citizens pay significantly more income tax than Americans in order to cover government-funded programs such as Social Security. Many French employers say high taxes do restrict them from hiring more people.
People are very happy to pay nothing out of pocket. They don't always realize that on average they pay about 3,000 euros per year.
But the United States' lower tax bite is countered by the fact that Americans end up paying more in premiums and out-of-pocket expenses each time they require medical care. Additionally, doctors in France make less money than those in the United States. French general practitioners make on average nearly $112,000 a year. In America, a general practitioner can expect to make around $218,000. This gap in wages, however, does not factor in the cost of becoming a doctor in each country.
That's so true.
American doctors must take on the cost of medical school, while French doctors receive that education free.
Moral of the story, that's why you get paid less, because you're not paying back a huge student loan.
That, and it also does make sense too. Like, if you didn't have to pay for college, I don't know the cost of living too much, but I'm sure it's probably less expensive than over here, like in certain areas.
Well, also, what's minimum wage? Like, what's,
they probably pay the people more over there.
I don't say probably, because
most countries I've seen, they have a higher wage, like for pay.
I don't know. Why don't you Google it? You literally have your phone right there.
We let the community talk about it.
Okay, well, we need to consider minimum versus cost of living,
yeah,
all that
I
type
know.
of stuff, just to say. But if you just look at student loans alone, like, that is like one of the only ways I'll rationalize why certain professionals get such a high salary, is because I'm like, well, they're in school for a long time. Not only that, like they're paying a lot back. I mean, unless their parents are wealthy enough to just pay it off for them. I don't know.
Yeah, I know someone who went to medical school, and their loans were about $200,000.
Okay, yeah.
And they only paid it off because they were putting like all they made every month towards it, besides of the bare necessities.
Right.
But yeah, I mean,
it just shouldn't cost that much to go.
No,
to
I know,
school,
but
period,
I think in France, probably, correct me if I'm wrong, but 111,000 average. I'm sure that's actually like pretty decent,
comfortable.
Yeah, like exactly, that's what I'm talking about. And then if you factor in that you don't have the loans, like we were saying.
That's literally what you said.
Yeah. And then when you think about it from the patient side, they were saying they pay on average about 3,000 euros per year in the taxes.
Mm-hmm.
But
income tax. Yeah.
Yeah, but they're saying here that it actually, you end up paying more because of all the premiums and the payments that you have to pay for like anything that happens. Yeah. So I don't know. Yeah.
I'm trying to think.
Our dog snores so funny.
Can you bring your calculator out? Is that $400 a month? Cause
math time with loners.
No.
$250 a month.
Okay, but
that's
like,
not
if
bad.
You think about that, it's like people pay. Okay, so I just did like $3,000 a month, and that's $250
a year.
Sorry, that's $250 a month.
Mm-hmm.
I feel like.
But it's on average.
That's pretty normal.
Yeah, but
like it's probably the same here.
Yeah, exactly. But like, I would pay that €3,000 a year if I knew that if something were to happen to me, like really bad.
But $3,000 on top of what you would already pay in income tax, because if you think about it, our income tax is about that much too.
Yeah, I know.
So honestly, I've had mine, I think, be more than that.
Yeah.
And depending on like how many hours. Anyway.
It does seem like it equals out to more.
So it's like,
here
okay,
anyway.
We're already paying it. Like, what the fuck's it going to? The military?
Yeah, and I'd rather know that, like I said.
Rather go to healthcare.
Yeah, exactly. Because like anyone you love or know, you know that they're going to be covered if something happens.
Yeah.
And so that just seems more
just
logical.
Logically,
yeah.
It would make more sense.
Yep. Exactly.
You're already paying it here. Might as well use it on something.
Yeah.
whatever.
Because if you're paying,
we all know the intentions of.
Yeah, I know. If you're paying like $300 or $400 a month on your premiums, and then on top of that, something really bad happens, like knock on wood, like cancer or something, and you have to pay out of pocket, like insurance only covers 20 grand, but it's 80 grand. So then you have to pay the other 60 grand on top of that. Like that's where it gets crazy. Yeah.
Honestly, medical debt here is such a joke, and student debt here.
It's like 60% of why people are going go
it's
bankrupt.
A joke.
Yeah.
Well, most people here are one inconvenience away from being homeless.
Yep.
Like that's it.
It's crazy.
But
American doctors also must pay for malpractice insurance, whereas such lawsuits are not a big issue in France. A common complaint in France is that certain areas do not have as much access to healthcare as others. However, France has more doctors per resident than the United States does. For every 1,000 residents, France has 3.4 doctors, whereas the United States only has 2.6. Some French hospitals are also struggling with the rising costs to care for patients.
The fact that budgets are very tight generates lots of tension. So hospitals are under lots of pressure right now.
So what can the United States learn from the French system? France's Social Security proves it's possible to cover every citizen without a government-run system regulating choice and how doctors practice medicine. It also shows that universal healthcare coverage can coexist with private insurance.
Basically, France has really done it right. As the World Health Organization said, very good health outcomes. Everybody's covered, all their citizens, all their alien workers, tourists, and half our costs. So I think they're doing a lot of things right.
Wild.
Huh. So yeah, tourists are covered, but I'm sure, you said, you probably have to pay, but much less. Yeah. That was a good video. It's interesting. Theirs seemed a little bit less confusing than Germany's, because Germany's seemed a little confusing when we watched the other one.
I agree.
But nothing is as confusing as ours.
Yeah.
Because we have all the different premiums and the deductibles, and the copays,
Yeah.
It's crazy because if you really want to know about your insurance, you have to go through like a bunch of pages on PDFs about like saying this is covered, but if this happens and this happens before this, then this is covered, but this isn't covered if you do this. Like it's all these little things.
Right. There's so much fine print.
Yeah. And like no one's going to go through and read that. Okay, maybe like a few people. But like,
even if they do, they're not going to remember it if the circumstance comes. And you're like, wait, did it cover that?
Exactly.
Me hitting my toe against the couch? Like, come on.
When I split my toe open at her family's house, I didn't even want to go to the hospital, but but then my toe was like hanging off to the side. I was like, we have to go.
Well, okay, so we went to urgent care originally because it's cheaper than emergency room, and the lady literally came to the car and was like, no, go in there.
She's like, we can't fix this here.
Like, don't even come in. Just go to the emergency room.
Oh man. But the first thing that when I sat down with my toe like hanging off, they were like, okay, and how are you going to pay for this with the insurance? Seriously.
They're not supposed to ask that.
The first thing they asked was like about the insurance.
They have to treat you before asking about that.
They didn't.
They're supposed to.
Oh. Well, that's weird.
They try to find ways to get it out of you, but
probably to see if they're gonna.
Even if you said I don't have any, they still have to treat you.
But
there's like nothing. They'll bill you, but they still have to treat you.
But I think they'll also, if they see that you don't have insurance or that it's gonna be harder for you to pay, they might treat you a little different.
Put some scotch tape on there for you.
Yeah, honestly, they might treat you a little bit different, but
it doesn't come out of their pocket.
Yeah, I know, babe. But some of these people, they really feel like their job is their life, and so they'll get like a pat on the back if they do that.
Right. I felt really bad. My mom called me like really distraught yesterday. She deals with like a lot of the administrative insurance side of, the hospital she works at, and she took a day off, and then when she came back, her boss was like, I don't know, she works from home, so she gets a lot of like not reports. She gets a lot of cases, I guess, if you will.
Insurance cases?
No, it's like basically she's a median between the insurance and the patient.
Oh, yeah,
and making sure that their insurance is going to cover what they're doing before they go to the actual hospital and go to their appointment.
Got it.
So she was really upset because my mom's super empathetic, like
probably too much.
Crazy, but she has like a good heart. So she feels bad for people extremely easily. So, and her boss was pretty much trying to tell her like these are all people that pretty much have appointments tomorrow and their insurance doesn't cover what has to be done. So pretty much tell them don't go to their appointments. the day before.
And
she was pissed because, one, she's never had to do something like that. And then, two, she's like, and her boss was pretty much telling her, like, hang up in their face. Like, just tell them, do X, Y, and Z, and then call the number, or say X, Y, and Z, and then you can, if you have a question, call the number in the back of your card. Have a good day, bye. Like, I don't care what you have to say.
They want her to be cold.
But, yeah, and I'm like...
That's not her.
But I feel bad. I told her, I was like, Mom, it sucks. I said, but you have to detach your feelings.
She probably is the one who's like, okay, girl, but you're going to do this and we're going to figure it out.
If they weren't recording her phone call, my mom would be like, she'd be like, trust me, I know
but
this is BS, but you know you should. That's the type of person my mom is, But
because we say when she figures stuff out, she figures out ways to do it.
Yeah,
like,
my mom definitely knows how to finesse stuff.
Yeah, that's
but
so
anyway,
funny.
Okay. Hope you guys
video.
had a great watch and listen.
Hope you had a good experience with the loaners. If you did, like and subscribe and jump over to our vlog channel. We've been noticing people have been jumping over and following on that one.
Yes.
Appreciate it.
Keep
your eyes peeled on that channel.
All 215 of you.
There's 219 now.
Thank you. 19 of you. Thank you.
Cool. But thank you guys for dropping in. We appreciate it. Peace, loners.
You okay? What is the pointing?
Shouting them out.
Peace.
All right.
Peace. Peace out. Ciao.